Hello, mister. My name is Clever Isaac Guamancunis. My topic is realizing the trend of molecular target therapies for cystic fibrosis. Definition: cystic fibrosis is an inherited life-threatening disorder that damages the lungs and digestive system. It affects the cells that produce mucus, sweat, and digestive waste. It causes the fluids to become thick and sticky. They then plug up tubes, and perseverate system vary and can include gout, repeat lung infection, inability to gain weight, and fatty stools. Great video.
Now that's a question. Cystic fibrosis is, well, a lot of different things to a lot of different people. Nearly 11,000 in the UK. And in the UK, each week, 2 people die from CF and 5 more babies are born with it. Which probably means a lot of you are watching this in search of answers to that big question. So, let's get started. Cystic fibrosis is about genetics. You can't catch it. But if both your parents have the CF gene, there's a 1 in 4 chance you'll be born with the condition. About 1 in 25 people carry the gene, and most don't even know it. And I should say at the start, there's currently no getting rid of it. All sounds a bit gloomy, right? But whilst there's no cure, a lovely life is still possible. Just look at me. You see, I have CF, so I think I'm a good person to tell you a little bit more about it. Cystic fibrosis is caused by a faulty gene that disrupts the movement of salt and water in the body's cells, making the mucus in people with CF thicker and stickier. This sticky mucus causes problems, mainly in the lungs and digestive system, but also affects other parts of the body too. It's not nice. The small airways in the lungs can get clogged up with this mucus, causing infections and, over time, damage to the lungs. So, what does all that mean for everyday life? Well, here are some of the symptoms. Frequent chest infections, severe or prolonged coughs, wheezing or shortness of breath, abnormal bowel movements, difficulty gaining weight, and for most men, infertility. There's also the issue of never being able to meet up with anyone else with CF. Basically, we could make each other unwell because of the bugs and infections that get transmitted between people with the condition. For better or worse, CF is a part of me. It may be an unhealthy relationship, but there are a lot of daily treatments to tackle cystic fibrosis effectively, which can make our union that bit more harmonious. A whole host of antibiotics to fight infections in my lungs. They're not all that colourful, but you get the idea. Physiotherapy to help shift the mucus that builds up around my organs. Enzyme capsules to take with food. They're really not that hard to swallow. And talking of food, we need a special high-fat diet to make sure our bodies get all the nutrients that it needs. And more drugs to thin that sticky mucus. People with CF sometimes need to take over 40 tablets a day. It's a burden for sure, but it's the preferred option. If conventional treatments no longer work, a lung transplant might be needed. Cystic fibrosis presents daily compromises and challenges, but with careful management and the right treatment, people with CF can lead full and happy lives. Work, travel, family, it's all possible. Recent figures suggest that half of people with CF will live past their 47th birthday. But it's also thought that a baby born today with cystic fibrosis could live longer as life expectancy continues to increase with the amazing advances in treatment and care. So, what is cystic fibrosis? It's a serious condition, but one that an army of people out there are very serious about beating for good.
Application in nursing. How does it work? Drug development efforts were initiated in hopes of restoring the function of the protein affects the cystic fibrosis. The cystic fibrosis transbrandment conducting regular serves as gate channel for chloride ions, helping to maintain the balance of salt and water in the lungs, pancreas, gastrointestinal tract, sweat glands, and other organ systems. Watch the video. Any, any that does manage direct to proper location in the cell membrane is deficient in activity. So the search for therapies had to include both small molecules that could correct the misfold on the CF3 proteins corrector and thus then could activate its fusion when enrich the cell membrane. Yeah, watch the video.
In this video, we will be discussing about cystic fibrosis. The cystic fibrosis is an autosomal recessive disorder where affected gene is CFTR that's present on chromosome number 7. First of all, we will see what's the function of CFTR gene. We see the CFTR gene is present on DNA, transcribes into mRNA via transcription process, and this all happens within the nucleus. After that, the mRNA is transported out of the nucleus and gets attached to the rough endoplasmic reticulum. Here on rough endoplasmic reticulum, the ribosomes take in the mRNA molecule and initiate the translation process. And through this translation process, we finally get the CFTR protein. So now we have the CFTR protein through this gene expression. This CFTR protein is a channel protein, chloride channel protein, on plasma membrane of epithelial cells. Now we have the CFTR protein that's present at RER. So from the site of synthesis, that's from RER, it's transported to the plasma membrane of the cell, where it will act as a channel protein, and these CFTR protein channels are mostly present on epithelial cells. When we see the epithelial cell, the CFTR chloride channel protein is present in plasma membrane, and inside of the cell we have chloride ions and water present. And to the outside of the cell, we see we have mucus on its surface, a thick mucus. But it's this CFTR protein which transports the chloride ions out of the cells and also draws water out of the cell through the process of osmosis. And with this transport, the mucus that's present on the surface of epithelial cell is thinned out. It maintains the viscosity of mucus. But things change here. When there is a delta F508 mutation in CFTR gene, at that time the CFTR protein is absent in plasma membrane. The delta F508 mutation is the deletion of phenylalanine amino acid at 508 position on polypeptide chain. The F is the symbol for phenylalanine. So when there is delta F508 mutation in CFTR gene, the gene is transcribed well into the mRNA. We also get the CFTR protein from translation. Everything is going well till now. But only thing that lacks here is that CFTR protein is not able to get transported to the final destination, that's to the plasma membrane, due to some folding errors. So when there is absence of this transport channel in epithelial cells, there will not be any transport of chloride ions, and water will not be drawn out of the cell, with which the secretions, with which the mucus, which are usually thin, instead become thick. So what happens when the mucus becomes thick? We have like lung disease results from clogging of the airways due to the mucus buildup, which results in inflammation, and there are several other conditions related to cystic fibrosis. Now let's see the genetics of cystic fibrosis. This being an autosomal recessive disorder, will need to have two mutated copies of same gene or allele in an individual in order to express itself. Let's say capital A denotes the normal CFTR allele, while as the A star denotes the mutated CFTR allele. Then within the individual, the possible conditions may arise as AA normal individual. When both the copies are normal, there may be A and A star individual. It's when one copy is normal, the other copy is mutated. This will give rise to normal individual, but this will be a carrier one. And finally we have A star individual. It's when both the copies are mutated. At that time we have affected individual that has cystic fibrosis. This condition only arises when both the parents donates mutated allele. That's one from father, one from mother. So this is all about cystic fibrosis and it is genetics. I hope you like the video. If you like it, give it a thumbs up and make sure to subscribe to the channel.
Pros and cons. The pros. Although only approximately 5% of patients with cystic fibrosis is thought to benefit from injection, their urgent clinical response survey does simulate vigorous pursuit of drugs for more common cystic fibrosis cause mutation, especially the P58, the C53 mutation. Immune reaction on correct cells emerges quickly, and clinical trials produce this point result. Then watch the video.
Number 4. New medication for cystic fibrosis.
Passing a hereditary disease to a child is one of a parent's worst fears. Although uncontrollable, 1 in every 35 Americans is born with a defective cystic fibrosis, or CF, gene. With CF, mutations in the cystic fibrosis transmembrane conductance regulator, or CFTR gene, cause the CFTR protein to become dysfunctional, making it unable to help move chloride to the surface of the cells in the body. Without the chloride to attract water to the surface, the mucus in various organs becomes thick and sticky, causing it to clog the airways and trap germs, leading to infections, inflammation, respiratory failure, and other complications. But there's a new combination drug to help the CFTR protein work, effectively thinning mucus. FDA approved in October 2019. The medication can be used in patients with the most common CF gene mutation, F508del. An estimated 90% of individuals living with CF in the United States have at least one copy of F508del, and no medication to date has been applicable to such a large group of individuals living with CF. Clinical trial results show the medication increased patients' forced expiratory volume in 1 second, an established marker of CF lung disease progression, by nearly 14%. This advancement in specialized CF care has the potential to add years and quality of life for many living with the condition.
Jesuit athletes in Ecuador. Ministerio de Salud Pública. The MPS of Ecuador publishes in a clinical practice with a manual of fraudulence in the case of where it indicates the general recommendation for its diagnosis according to clinical evaluation. Watch the video.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CF Care team about how the different parts of your treatment plan can help keep you healthier. As your partner, they can help you find ways to fit your treatments into your daily care routine.
In conclusion, the result of a pair of phase 3 clinical trials in the journal for and simultaneous publication in the Lancet document impressed benefits from drug therapy for persons with cystic fibrosis and at least one copy of the P508. The C50 mutation will represent approximately 90% of persons affected with life-shortening autosomal recessive disease. That was the video.
A patient with cystic fibrosis is susceptible to infections of the lungs. This is due to a mutation that affects a protein on the surface of lung cells. Many different mutations can cause cystic fibrosis, but all of them involve a transmembrane protein called CFTR that functions as a channel for chloride to move in and out of cells. In this case, CFTR is less able to transfer chloride ions out of the cell compared to the functioning protein in people without cystic fibrosis. The channel is, in effect, locked shut. This inability to transfer chloride ions has an effect on the outside of the cell. In people without cystic fibrosis, there is a balance of chloride ions inside and outside lung cells, which maintains the right amount of water and salt ions in the mucus lining the airways. Cilia normally sweep the watery mucus from the lung lining, keeping the surface clean. In patients with cystic fibrosis, chloride ions concentrate inside cells and draw in water by osmosis. With less water, the mucus becomes thicker and cilia can't move. Flow is reduced, providing an environment for bacterial infection. But there are now drugs that can help patients. To find a drug, researchers tested over 200,000 small molecules to see if any would bind to the CFTR protein. Then, for each small molecule that had some binding ability, researchers chemically synthesized different variations of that molecule and tested them for the ability to improve the function of some types of mutant CFTR channels. They identified a drug that, when taken by patients with a certain type of CFTR mutation, binds to the CFTR protein, opening the channel and allowing improved ion transfer. This increases chloride ion flow and maintains a watery, clear mucus, which helps the cilia move more freely and reduces the risk of bacterial infection.
Thank you.